If your child has been diagnosed with autism on a history or background of traumatic birth or very challenging health in those early hours and days of life, you may be asking whether he or she was failed in some way by the care they received. Hello, I'm Cian O'Carroll, and our firm of solicitors here specialises exclusively in medical negligence law. Back in 2019, we acted for a family who were bringing the first successful action in Ireland for what could be described as birth trauma-related autism. Autism is a spectrum of symptoms, and it also has a range of causes. But some cases have been related to traumatic birth injuries, either an absence of oxygen in the immediate period around the child's birth, or perhaps some complications immediately following the birth. In those situations, legal issues can and now often do arise, and this firm has a particular speciality in that area of practice. One has to be realistic about these types of case. They are extremely complicated. They involve large numbers of expert witnesses, typically brought in from a variety of countries, to share their expertise with the court and to establish whether, in the first place, a failure in care has occurred that resulted in an injury to the child's brain, and secondly, to link that particular injury with their ultimate diagnosis on the autism spectrum. They are, as I say, very complicated cases, often hard fought. However, they are hugely important and significant for individuals and for their families. Because through cases like this, when brought successfully, life-changing provision of care can be achieved. Since that initial landmark case for Fianna Phillips in 2019, many more cases have been brought successfully. And across all those cases, there have been clear common features. Perhaps chief among those is that each child has been born with quite obvious and striking signs of recent deprivation of oxygen. That is the injury ultimately that affects their brain. That deprivation is typically evidenced by the diagnosis of hypoxic ischemic encephalopathy by the doctors. And that itself is evidenced by things like abnormal umbilical cord blood gases, where analysis of the blood within the umbilical cord has been shown to indicate heightened levels of carbon dioxide or reduced levels of oxygen, heightened levels of lactate. These are very important biochemical signs which will be evident from the medical records when examined. The baby, him or herself, may show some degree of jitteriness or perhaps even seizures being noted in those early hours and days of life. The tone of the baby may well be affected, either being extremely floppy or extremely rigid. And these and other symptoms and signs will be evident from the medical records. And hopefully it will allow an expert instructed by us on your behalf to advise on whether or not there had been a hypoxic ischemic encephalopathy. The next step is to then identify what other potential causes there may be, either environmentally or through a different trauma or perhaps through genetics, for the autism spectrum diagnosis. Again, experts can assist in determining these complex factors, and if at the end of that admittedly difficult and complex process, there is a clear conclusion that the autism spectrum diagnosis is attributable to a want of care either in the course of the delivery and labour for that baby or the early neonatal care, well then proceedings can be brought. A process then begins to identify all of the needs in terms of care, therapy, housing, special education, and support for the family in a broader sense. What all of those things will cost, quantify them, document them, and bring that case as quickly as possible to achieve a successful outcome in a speedy and timely way for the family and for the child affected. None of that is to say that autism is solely attributable to birth trauma. It is a very complicated matter, and perhaps only a small number of cases are attributable to injuries in the context of birth or early life care. Nevertheless, if that is the case, a person affected is entitled to know that, and they're entitled to redress and to ensure that their future care and their future needs are provided for adequately. And it's that work that we do.